here and we'll get them shared on our side. We'll assist for a minute. There we go. So yes, we've got 3 to 3, Chris. You can hear, you can see, you've got your slides in full screen. So I will see you in 20 minutes from Q&A.
Fantastic, sir. Thank you very much. Right, so we're exploring technology-enabled care services today. Just a little bit about myself. I'm Chris Elkin. I'm not medically or clinically trained either, but do have quite an extensive background in the digital media industry. Spent a long time, like our previous speaker, creating online learning for colleagues within the NHS, produced award-winning apps, been around quite a little while, you know, in some shape or form. I'm really interested in and passionate about, and this is sort of, you know, at the heart of Piota, it's about making things easy for people, reducing that thing about making me think. I think if IT solutions are really quick, really easy, people don't have to think about them, they're more likely to do it. If it becomes a little bit complicated and you have to think about it, then you'll perhaps go away and do something else. So yeah, at the heart of what we do, really passionate, is about making everything really easy for people to be able to manage and cope with. A little bit about our organisation. We've been around in the healthcare sector for about 4 years now. As a business, we've been around for about 6 or 7 years. But we've got over 130 now health and social care clients across the UK. So some of our big clients, NHS, Public Health Wales. We work with a number of the large trusts or health regions in Scotland, and we've got lots and lots of examples of work with hospitals, trusts, CCGs, cancer alliances, you name it. We're working with people within the health sector. We've got a health platform, an app platform, and this can be configured very, very quickly and easily to meet the needs of our different teams. This is a selection of apps that we've created over the years. You'll notice that they all look the same. They have a logo, they have some branding, they have a menu system, and behind those menu systems we have specific functions. But we do lots and lots of work within healthcare apps, so looking at providing patients, families and carers with information awareness around their illness, around their rehab, around their prehab, really providing lots of education. I think, you know, providing people with information, specific information about their conditions. We do a lot of work with the cancer services at the moment. You know, with everything that's going on with the pandemic, I think it's been difficult for people to get into hospitals or not wanting to get into hospitals. So the teams have been able to remotely provide support, information directly to people's phones and handsets really quickly and really easily. It's not searching about on websites and trying to find the information. It's providing trusted information from your clinician directly to people's phones and devices. And it's not just about the patient, you know, it's about families and carers as well, so everybody can be in the loop and understand everything that's available to people. Similarly, we do apps for staff apps. So we do a whole plethora of apps for NHS staff or care home staff, providing them with timely information about the service, about well-being, about, you know, support networks and various different things that are available to them. So what we're really doing is we've got an app solution that we can quickly customize to meet your needs, and you can then roll it out to your audiences, whether they be internal or external. So let's talk a little bit first about improving the patient experience. I think over the years, it's not a new phenomenon, but I think communications has always been a big problem for the NHS health and social care sectors, in that, you know, people aren't getting the information they need in a quick and timely fashion, having to search around for it, or they find it difficult to liaise with, you know, their providers. So we've seen this as an issue for a long time, and we think that our solution helps solve that problem. We're looking to obviously improve the patient experience. I think that's, you know, what we're trying to achieve, and that's what all of our clients are trying to achieve, is again trying to provide real key information to their patients, their families and carers quickly and easily. You know, I think if we can reduce some of the stress and some of the anxiety, if we can prepare people for, you know, the future, then, you know, it just makes their lives a hell of a lot easier. if we can provide that information to families and carers and support networks, you know, they can help as well in certain situations. So just making all this information available to people using a medium that, let's be honest, we all use our phones now, you know, almost extensively, I guess, for the internet is just, you know, a really straightforward way of reaching out to those people. I'll give a couple of examples. This is a healthy weight app. So this app is really aimed at reducing dare I say, obesity, or you know, providing people with information or about healthy weight and weight management, exercise, etc. This is from NHS Israel, and this is one of their many apps that they've created with us. As you can see, the app is their logo, and then the tiles below it, the menu system. These are all based upon the information they want to provide their, you know, their patients with. So really easy to install, easy to find, and then really easy to get information. But they have lots of news about what's happening within the area, how people can, you know, help themselves, help tips, lots of information, lots of education about being able to manage your weight, or, you know, manage a loved one's weight. They have information about local activities or local groups. Again, it's just making, you know, their audience is familiar with all of the different resources that are available. Some of this information historically may have been given out in patient leaflets, or, you know, there might be some information on the website, but it's all scattered everywhere. So being able to bring it all together, put it all into one place, a bit of a one-stop shop, if you will, just makes it a lot easier for patients. You know, whenever they've got a question, whenever they've got a thought, they can jump onto their app and the information hopefully should be there. They have weekly topics, so, you know, trying to make this thing sticky. You know, healthy lifestyle topic of the week. So, you know, forgive the pun, but they'll have flavour of the months, certain things that they want to focus on, and they'll use the app to be able to promote those different topics throughout the year. They're using it to, you know, to put on lots of interesting recipes, again, you know, aimed at helping people to manage their weight. We're using push notifications and alerts. So, you know, everyone's got a phone these days. Everyone's got those little red circles with the numbers in them, with the push notifications from the favourite apps. This is exactly the same. This is a great way for the organisation to be able to reach out and to get people's attention about the various different things that are happening. And as you can see on this one's about workshops and recipes and all the different things that are happening within their particular area. They can use the app to be able to reach out to their folks. Another example is a app we put together for Chester Royal Hospital. And again, this one is for cancer patients. We're finding, or speaking with the team there, what tends to happen is people are diagnosed and then they come to the Macmillan team, and obviously, you know, there's a massive amount of information which they're finding very difficult to process at that stage. So the Macmillan team are giving them almost like a little business card, talking to them and sort of suggesting that, you know, we've got an app here, all the information you need, all about the services, the support, financial support, contacts who to speak to, everything is all in one place. You can come to this app whenever you want and you can find the information that you need. So it's a really good, trusted repository of information that the patient, as I always say, the family, the carer, the support network can come on and find information about when they're ready, you know, when they're available. It's not, you know, being scrambling away trying to navigate the internet and find the right page and find the information. It's just all very focused. Within a couple of clicks of opening your phone, you can be on the app and the information's directly there. So there, again, talking about the information unit here, and this can all be done remotely. You know, people can do this over the phone. They can talk about the app, and I think, you know, again, most of us are using smartphones and know how to download apps directly. So, you know, the support team there will just direct you where to go, which app store and which app to download. But once you're there, there's all the information that you need. So you don't need to go into the area to find out or ask. It's all on the app. We've got information again about the financial resources that are available, about some practical resources that are available. A lot of information. All of our apps come with a translation aspect to it. So the information within the apps themselves can be translated into, I think there's 120 different languages that you can translate into. So you know, anybody within your audience can pick up this phone, load the app, and then translate it into their native tongue, if you will. Contacts directory, another great resource. So you can scroll through the contacts directory, you can press on the call button, and because it's on your phone, it will call directly. You're not having to transcribe from one system onto your phone, and you get the numbers mixed up, and before you know it, you've scrapped that idea. You know, it's just really quick and easy. You press a button, you get through to the team. It's simple. Just before I go, I just want to talk about the other side of what we do. So it's about increasing sort of staff wellbeing and engagement. So, you know, looking after your teams, or using apps to be able to provide resources to your colleagues to provide, you know, more efficiency in various different services, if you will. So again, it's the same sort of scenario, you know, where people are at work. We're getting this more and more, where clinicians don't necessarily have access to a direct access to a PC. You know, people within sort of clinical areas, within the ward environment, you know, there might be a couple of shared PCs on the nurse's station that you can get access to, but it's normally, you know, kind of when you get home, when you've got opportunity to think about it, and in those instances you don't necessarily have access to the system to be able to do whatever it is that you want to do. So again, we're seeing a massive increase in organisations looking to provide engagement, communications, toolkits on mobile phones, because people have always got them and they can always access the information. So this is an example. This is more of a sort of a toolkit, engagement toolkit, but this is for a team at the Dudley Group, for their emergency department team. Really simple app. Again, you know, same principle. It's their logo. It's a menu system that we've agreed with the team there, to make it really quick and easy for their colleagues to be able to find the information. So this is aimed at clinical staff within the ED team, but also, you know, students and others that are kind of coming in that need to get that information. There are computers within the system, but, you know, sometimes there's a bit of a queue to go and find them, where, you know, this can just be pulled out of a pocket or a tunic, and you know, people can be accessing the information literally within seconds. So this one you have to register first. So it's got a list of people's NHS.net email addresses and backgrounds, and once you've registered, I mean, the system validates you, sends you a 6-digit code, and then the app's open. So once it's open, you can go into the different sections. This is all of the standard operation procedures, the policies, procedures, and people can kind of quickly go through and find the information they want. Clicking on any of those links will take you to either a PDF document or take you to a web resource, perhaps, where you can you can browse those policies. Lots of different guidelines. Again, you know, clicking on the different areas will open up the guidelines. This is forms for, I think, resuscitation for paediatrics. Again, clicking on any of these links will take you directly to the protocol or the guidelines. You can open it up, you can read it. You've got that information literally, you know, within a couple of seconds, as opposed to, you know, having to go onto the internet, logging in, searching for it and finding it. So it's just, you know, it's just increasing efficiency and providing much more information, I suppose, to those that need it when they need it. But yeah, lots of information about different diseases and different guidelines. They've got a link to their rota on the system, so their colleagues, again, wherever you are, you can just click onto the link and it'll open up the rota. Obviously, I can't show you, but yeah, they can click onto the rota so they can get that information from home, you know, on the bus going home, on the train, wherever it might be. It's always available for them. So they're just making it much more accessible to their colleagues. I've got a bunch of forms on here. You know, one of the functions of our app is to provide forms or surveys. And if you've used Smart Survey or SurveyMonkey in the past, it's that kind of scenario. So they can quickly build forms and distribute those, and people can use their phones to complete them. So they've got simple things like annual leave request forms. They've got handover sheets that they're using. That's on the clinicians to talk about the shift and how, you know, how it sort of went, and, you know, what some of the issues and problems were, and they can submit those directly to an administrator who will then collate and action them. Again, just another quick and easy way of doing some of this stuff, where ordinarily, you know, you'd be sitting around waiting or trying to get onto a system to be able to do it. we can just do this quickly and remotely straight out of your pocket. Another big list of directories, a directory of consultants. So for those that have got questions that need to speak to people, they can press on that call button. That'll take you straight through to these people. You're not searching around looking for information. It's there. It's quick and easy. People are having to think, and they're more likely to do it. Information on mandatory training. So I guess this is more for the new staff that are coming on board, but it gives lots of information about the training, what they need to do, how they need to do it. In some instances, I think you can go off and there are training resources directly on there that you can access, forms that you can complete. Is again just making stuff accessible for people. If they don't have to think about it, they're more likely to do it. And this is some links, I think, to different colleges. So just bringing all of the information that their colleagues need, putting it all into one place and making it accessible from their smartphones. Again, they've got alerts, so lots of different things that are happening throughout the team, whether it be different training, whether it be Wi-Fi downtime, whether it's different systems that are up or down, whatever it might be. The administrator can quickly come onto the system, send out alerts, and everyone's aware. So finally, to wrap up, let's just talk quickly about the solution itself. As I say, there's two elements to it. So we've got the app, which can be configured, and we can put your logos in there, work with you, change all the icons and labels. But then you've got a web-based administration tool that allows you to manage the content within there. This is super simple stuff. As I say, I've been around for a while now, and this is probably one of the most simplest systems that I've come across in terms of use and ease for people, non-technical people, to be able to come on and sort of manage this. So you can come onto the system. You've got a whole plethora of tools at your fingertips. You've got analytics to be able to demonstrate how many people are logging in, what sort of content they're looking at. So again, you can start to build up some kind of heat map of the information that people are looking to work towards, and that can help you with your communications campaign going forward. So to alert people so that there's other information on there, or whatever it might be. This is just an example of a simple screen. So this is for the editor. And say all of the icons on here about changing text and inserting videos, and YouTube inserting videos or PDF documents. It's super simple stuff, and people have used this, again and again and again, I guess, whether it be Word or Excel, or not Excel, sorry, a PowerPoint. A lot of these tools are already familiar. So what we would do is provide some training on this. We support you through the license, but it's super simple stuff. What's a typical process look like? Well, there's always the initial inquiry. I might come up to this event, we might contact you, might you contact us, but we'll have a Teams meeting, a Google Hangouts, talk about what you're trying to achieve, what your problems are, what your challenges are, and we can then sort of demonstrate other apps or other solutions that we put together for similar clients with similar issues. So we can have a sort of chat about that. What we then do is, part of the process is, if you are committed to this, we can produce you a free trial. So we'll put together an app for you, put your logo, your branding on there, put some of your content into situ, where you can then go and show that to your colleagues, you can show it to your management team, put it in the hands of some of your patients, families, or carers, get their feedback. What we're trying to do is make this as realistic as possible, in order to sort of stimulate that conversation with your audiences. So we'll put a trial together, give you some training on it, and show you how to use it, and then submit a proposal in terms of costs and how it all kind of works and all fits together. Ordinarily, then you go away and speak to your different colleagues, to the different teams, and hopefully get some kind of acceptance. And beyond that, then we can officially kick off the project and kind of get you working on the app itself. All of that, in terms of elapsed time, we can probably do that, in a few hours. The teams are half an hour. The trial, we can get that to you normally next day. You've got up to 30 days to be able to demonstrate that to your colleagues, and obviously, getting sign off and things is something that's different in all different organisations. The best we've done thus far, or the best, it's not a race, but we were approached by CCG at the start of the pandemic. They wanted to create an app for all their care home staff. Obviously, lots of different things happening in care homes at the time, and they felt that they needed to really speak to everybody, not necessarily just the care home managers, and sort of cascading down some of the messages. They wanted direct contact. So I think they approached us early one morning with this challenge. I think by tea time the same day, they were sending emails out to all of this stuff. So we've got a new care home out now. This is the way that we'll be providing information kind of going forward, and kind of after the went. So, you know, with 8 hours, we've got an app out there for them. So as I say, it's all about being quick and easy. It doesn't have to be convoluted. It doesn't have to be a difficult process. It should be relatively simple. Right, I think that's the end of me for now. Hopefully I've not run over time. So I welcome any questions from any of the attendees today.
Hi, Chris. Yeah, got a fair few questions coming through. So we'll just get the poll on the screen now for delegates as well. So please take a look at that if you can. So Jessica started us off here with a question that you touched base on briefly in there, Chris, but I'm going to ask it anyway because we've had, well, 2 questions of similar nature actually. So please, could I ask, what is the annual cost to have an app to be developed and then to use, please?
Good question. Good question. One that I forgot about. You're all sitting down. It's relatively inexpensive, I think. And don't get me wrong, you know, we appreciate that every penny counts within the NHS, but for one of our apps, it's between £2,000 and £5,000 per annum. That will depend on the size of your service or the number of patients you may have or the number of staff you have. But yeah, anywhere between £2,000 and £5,000 per year, which again, from experience, is not a great deal of money if you're thinking about, you know, how much it would cost to go out to a third party to develop you something, or, you know, the costs for hiring, you know, somebody to come in and do it internally is not a lot of money at all. So yeah, we create that for you, and then it would be, in terms of the content, creating the content and managing the content, it's somebody within your team that kind of does that themselves. So yeah, relatively inexpensive.
Great answer to be able to give, Chris. Thank you for that. Jane mentioned here, can you discuss how you capture patient feedback and how it helps to develop the app you provide?
What will happen is the teams that we work with will create, using the forms or surveys function, those feedback forms. So they will be asking specific questions about the app, how it's helping, you know, what they'd like to see more of, what's good, what's bad, what's the ugly, and then the team will take that information in and obviously utilise that. But that it gives you that ability to be able to reach out and start asking those questions. We're finding, you know, a lot of teams are using it for other patient surveys as well. So, you know, things like families and friends, for instance, just to be able to send out a push notification to people that, you know, you've been in clinic recently. We really appreciate, you know, a couple of minutes of your time if you could just fill in 2 or 3 questions on your phone. Really simple stuff. You know, it's a lot easier than filling in a bit of a card and sending them back, or, you know, navigating around websites. So yeah, you know, with this system itself, with the functionality, teams can quickly, you know, send out forms, whatever they might be, surveys, whatever they might be, and then get that feedback and then deal with it whatever they feels best.
Brilliant, thank you for that, Chris. Rick has asked a good one here. What API capabilities do you support allowing us to extract data?
We're working with, at the moment, we're working with different organisations, or working with some organisations to look at APIs. It's not something historically that we've been involved with, but we're getting asked more and more about integrating directly into PAS systems. So it's on the development agenda. If there are organisations out there that are wanting to take this a stage further and work with us, then, you know, please get in contact with us, because we are obviously looking for live examples. But I think historically, you know, with some of our clients have already working with electronic PAS systems, we are creating links to those things. So, you know, on our tile system, if you can imagine, one of those might be, you know, view my records. We do a lot of work with Patient Knows Best, or for links to Patient Knows Best. So that will open up a page and tell you about Patient Knows Best and how you do it and what to do with it. And then there'll be a button that says, take me there. So in those instances, you know, we're running side by side with some of these web-based portals, but I think longer term, we're looking to integrate some of that patient data directly into the app.
Absolutely perfect. And I've got a great question here from Becky, which I'll just get out quickly before we move on. So Becky's asked, do you find the apps, apps are user-friendly for our aging population?
I think they are. I think that's the beauty of it. I think, you know, the simple navigation system, you know, a simple 3x3 grid of tiles with the menu system, You know, it's not a complex system. It is quick and easy, and I think anybody can pick this up and kind of get used to it. So, you know, if we look at some of the apps that our aging population again are probably using more and more now because of the pandemic, you know, I think if we're going to take some positives out of the pandemic, is a lot of old people now are using the phones more and more because they've been forced to. You know, once upon a time, I can remember and say, well, I'm not interested in doing this, but because of the pandemic, it's forced to take a step back and start thinking about, you know, using an app in that respect. But no, I think it's really, really simple, very, very simple in fact. So I think an aging population, you know, will be able to use it, no issues at all.
And the beautiful thing is, as you mentioned a little bit earlier on, the ability to feedback will of course help in establishing those areas where it might not be as easy to use, and then rectifying that for future reference. So
absolutely, yeah, absolutely, sure. You can get that nail on the head.
Yeah, perfect. Well, Chris, always a pleasure. Really appreciate the presentation. We will be able to share slides after the conference as well, I believe, Chris.
Yeah, all my contact details on there. People reach out and get in contact. Like I say, we can have a quick meeting. We can do your demonstration and we can do your trial. So thank you very much, Sean, for inviting us along. Really appreciate it. Thank you everyone for the time this morning. Have a great rest of your conference.
Cheers again, Chris. See you soon.
All the best. Cheers. Bye-bye.
Thanks now. Bye-bye. Right, everybody, apologies about my camera here. I don't know what's going on. My light is definitely not flickering, but it looks like it is. So yeah, we're here now anyway. So yeah, real big thank you to Chris and Piota for supporting the conference